and I have an important message for patients with cardiac diseases. We do know that patients with comorbid conditions like cancer, high blood pressure, or heart disease have an increased incidence of complication rates with COVID-19 infection. And therefore, it is all the more important to prevent infection in these patients with heart disease. And I would therefore urge you to follow the government guidelines in terms of self-isolation. Do not go out of the house unless it's very important. And if you do go, wear a mask. Social distancing is very important. Do not touch your face with your hand before you wash your hand. And once you come back, ensure that you change your clothes, wash your hands with soap and water. This will help to prevent the infection and will reduce the chance of complications even if you develop an infection. Let me highlight a few of the important do's and don'ts. The first thing that I would emphasize is that if you're on medications that have been given to you by your doctor for high blood pressure, for heart failure, or for cardiac disease, please do not stop any of these medications. I can tell you that they are all safe. Even if you develop a COVID-19 infection, you can continue with these medications and they will do no harm. They will continue to work for you, and therefore it is important that you do not stop these medications. The second message is that if you have a routine follow-up visit during this period, it may be better to avoid it. So give a call to your hospital or to your doctor and check if you can just continue with your present medications. And if you are stable on these medications, you can postpone your routine visit to your hospital. And that would be good for you as well as reduce the chances for infections. The third important point that I would like to make is that certain medications like blood pressure medications, you may read on WhatsApp or on social media need to be stopped, but that is not correct. Please continue with all your medications that you're taking at the present time. The fourth important message would be that many of you have been told that you should exercise regularly, and suddenly now that you are isolated within your house, you might wonder, how am I going to exercise? And a lot of your time is probably spent sitting in front of the TV, watching news or watching movies. I would urge you to exercise even within your house. Make sure you get up, walk around frequently, do some yoga exercises if that's part of your routine. I think it's very, very important. Finally, if you do develop fever with soreness of the throat or associated with breathing difficulty, it could indicate that you have a serious infection or even a COVID-19 infection. Make sure that you go to your hospital for this. Let me assure you that the emergency services are working in every hospital and that you can go to your hospital with these symptoms and your doctor will definitely take care of you. But let me also assure you that you do not need to panic. The vast majority of patients who have COVID-19 infections have a very benign course and they will get well within the course of a week or two. And therefore, you do not need to worry. So, in summary, let me emphasize again, isolate yourself, practice social distancing, and therefore stay safe.